the classroom and discussions. So this week there was a lot of discussion about policy in the United States on television. I don't know if any of you watched anything that you think might relate to the course. Yeah.
I thought it was really interesting that they kept talking about how much Ted Kennedy had done for healthcare and policy, and many things changed, and how maybe it may not be as easy anymore now that he's passed. And I thought that it was just very interesting that a lot of it was focused on everything he had done for us over the past 40 years that he was in the Senate.
So those of you who aren't aware, Senator Ted Kennedy, how many of you are aware of who he was? He died last week, and he was a senator, I think, for almost 44 years, maybe longer. And he was from the Kennedy family that started in politics with John F. Kennedy, although their father had been an ambassador to England just before World War II. And we're going to talk about some of the issues he was involved in, because those are issues in the class anyway. Somewhat the Americans with Disabilities Act, certainly health care reform. But he was there so long, he was involved with almost anything during that period of time that was domestic, related to what we're going to study. Although he wasn't instrumental in all those bills, his name is on many of them. And what you were saying is sort of true. The eulogies for him talked about how he was good at getting bipartisan cooperation. He was certainly a liberal Democrat, but he was good at getting Republicans to sign on to some bills by compromises. And we're going to talk about what those compromises are and how they occur sort of over the next couple of weeks of the class. He was also called in the press the last senator who aligned himself as a Roosevelt Democrat. And we're going to talk about that over the next couple of weeks too, because when President Roosevelt was in office, which was for a long period of time, including the Depression, some major bills related to older people passed, the most significant of which was Social Security. And there was a huge opposition to Social Security, as there was to Medicare. So the discussion we're having currently about health care reverberates with some of these policies that were passed before. And most of them were passed with a Democrat in office, but not all of them. We'll talk about Medicare Part D, which is for pharmaceuticals, and that was passed under George Bush, and he certainly wasn't a Democrat. But there were a lot of compromises with that too. So compromise is sort of two parties agreeing to disagree and each giving in something so that a bill will pass in Congress. So this week we're going to do two things. We're going to talk about what is policy, and some of that we're going to be looking at this tome. I'm sure it's really lively reading, having read it myself. But it's important to understand that there are theoretical constructs that try to explain what policy is and why things happen. And for us, we're going to try to walk you through some of these. Some of them are sort of competing. Some of them match up with each other. But like any theory in social sciences, there are competing theories to try to explain something. And you find this certainly in the natural sciences too. But it's harder to have absolute proofs in the social sciences, especially when they're so applied as policy. So when we talk about them, you'll just have to think that there's not one right answer. And maybe some policy and theories apply better to certain situations than others. And some have some political ideology connected with them. So we're going to look at the policies discussed in this book in a few minutes. At the end of the class, Bernard is going to talk about reading assignments where you're going to take some article and be responsible for running a 10-minute discussion in class later in the semester about it. But we're going to start with getting you to talk about different definitions of policy. Bernard is going to set the framework for this.
So Dr. Pynoos just mentioned that there's all sorts of perspectives about what policy is. And
I think you need a microphone. The online students can't hear.
the microphones up above, I think, are on. Jim just mentioned that.
Okay.
I wish I could ask if they could hear this. I'll speak loudly. So what I have here is a list of particular definitions that people from various fields have given to the term policy. And what we want to do is break up into groups and have you discuss one of these definitions and think about, from sort of a naive second day of class perspective, what you think your definition, what are the key elements in your definition that define what policy is. At the same time, there will be four other groups that are doing the exact same thing, looking at different definitions. So we also want you to look at the other group's definitions and sort of think about what your definition maybe lacks when you think about what other people have said policy is. So I think rather than go through the trouble of trying to move around, maybe we can just break into quadrants with one group in the middle. I think we want 5 groups, so maybe if you're feeling like you're on that side, you can just kind of, like maybe you can group with these people.
And if you feel you want to go out in the hallway and do this, that's okay too.
It's going to get kind of loud, but also this is obviously something that people at home won't be able to directly participate in, so I'm going to walk around with this wonderful microphone and eavesdrop on your conversation so that people at home who can be looking at the definitions can get a sense for what you're saying.
And we're going to need one person to report back, yes?
Yeah, in each group, one person will be the spokesman, and then in 10 minutes, 10 or 15 minutes, we'll get back together and we'll sort of start our discussion about what policy is. One thing that we always, a metaphor that always comes up about policy is that policy is a lot like making sausage, in that sometimes the outcome tastes good, but you don't really want to know what goes into it. So you may hear that metaphor come up a lot, and you can think about that as we're discussing this. So for the groups, let's just try to, let's just kind of play it by ear, maybe 5, 5, 5, 5, and then whatever's left over. So there may not be 5 people in every group.
It might be easier for people to turn around with their,
Yeah.
turn around.
This should be the easy part of the exercise. Is getting into the So when does everybody have this sheet? Yeah. The 5 definitions that we want to do, just put a little star next to the names that I'm going to list. Is everybody in a group? So, Morgan, how about if you work with this group? And then 4 there. Okay, is everybody comfortably in a group?
Yeah.
Okay, so put a little star next to these names. J.E. Anderson, C.O. Jones, E. McCrae, Evelyn Burns, and then down a couple of listings, Titmus, R. Titmus. And then this group will be 1, so that corresponds with Anderson, 2, 3, wherever 4 is, and then 4, and then 5. So you guys are doing Titmus.
You didn't even get 1. We're 3.
Okay, what I suggest is you each read over your definition and think about it, and quickly look at the others, and then talk about it as a group. What is it that your definition adds to policy, what's unique about it, and what might be a problem or a limit with it. They're all slightly different. So for the online students?
So the online students can just read through the definitions, all of them if you want, or the ones we mentioned, and then sort of work the exercise in your head until we get to the big discussion, and I will also walk around with the microphone to listen in.
Do you see that in the other ones? Or just in general, it should be in here?
Well, what's good about it? It's going to be the identify a problem and go straight to formulating a policy, adopting a policy,
Pretend I'm invisible.
for meaning.
The identifiable needs too, which I don't know if the other ones necessarily mentioned. They all talk about a course of action.
Follow up to
Organized effort to ask.
Present it to
stands out.
I don't think that has really been whereas this
And it's
Right,
being
and you
used
gotta
like
advocate for your show, you gotta present it. As hard as that is.
Policies that are created by lawmakers.
Before you can
It's
formulate your policy. And
also the efforts of society, not a particular entity.
Is that also a technique of getting legislation passed?
Does that fit under a definition of what official policy is?
Well, it might be. I mean, it definitely has. You kind of have to pick sides. I don't know the strategy. We could add the policy.
I just, in my, just it doesn't use, my opinion, the only way that a policy adopted is you gotta sell your idea to any political opinion, you gotta be able to sell your idea. I said it doesn't use its word in its own definition. That's why I wrote, I said the same.
When it says typically involves more than the administrative application of an existing supervising
That's how nice you word policy twice.
Yeah, I thought that too. You can use the word policy.
So it kind of makes it.
It's kind of bunching people.
They're trying to generalize laws for.
Only the definition actually gives a definition. Just say
Right.
Like good policy and then we say well what it really is.
It
Concept.
just states the process, yeah.
Like it could be a law, it could be a regulation.
It's a chosen course.
The thing that I think is missing is the main when I think of policy sites. How do you make choices and give away resources to whether it's money or laws?
Yeah, and also look at the other one.
How do you give things away or make laws? In a competing environment.
But I think that this is they say that so we could say that our definition is lack of statements. Policy. Maybe go to other parts. People with demographic or area. Positive or public interest. I think that's right.
Very big limitations.
It doesn't really talk about how it chooses.
I'm not so sure it's always organized.
So it's just the how, the what.
Pretty much everything.
Like the law, when they're
And like also like Gero talks about theory versus practice. Theory is applied and then that's what's actually done.
He doesn't do.
We were just saying our definition is kind of ambiguous because it uses word policy twice.
It's differentiating between
And one major fault that we
a
also
lot of that
have is
policy is that makes sense, especially when it's not an organization. I think that's the example.
yeah, and I think
But it is a policy, that makes it.
distribute finite resources.
actually, yeah, it's not just talk about this to be a good idea, but
And
I don't know if you really like the definition.
I thought it was more of a, I guess, process
how policy is implemented, but trying to get policy and the
And you mentioned like lack of balance, like, how you, well, if you're talking about, it seems like a step-by-step process. I was thinking like there's missing the first step, which is advocacy. It doesn't mention how you have to sell the issue first.
yeah, that's not more like it's describing the actual
Yeah, I was on the
I can present. I'm Aaron.
Why? Ideally, it should be, yeah.
how it got to be some policy may not.
Oh, that can be a lot of different.
So maybe what they're trying to get out of policy is like one piece of policy could affect a large number of different
I don't necessarily think it's always.
I think actually that's all orientation.
I think the intention
Did you go to the bookstore like 30 minutes ago?
Yeah.
I just saw you there.
right now, it's extremely fragmented.
It's only like real. I don't really mind.
I think ours is the most general.
I don't have it.
Depends on what you think.
Yeah.
Because it's more
I think the policy is going to be something very specific, like healthcare policy, or like in the post office.
Yeah.
Which I reference public
Government.
But it's not like what is the
Yeah.
to meet the need of more social problems though.
But let's so it also says it affects large numbers of people. But I'm still very so most of my classes have been social work. Education and government. Yeah. It was up to them. It was like which is fine. Actors are but in 6 weeks you can't grow.
The whole section is talking about the word policy and how it's socially
Last year. It was an online class. And then it says that's policy. And then we have lectures over the line. But the way that was I didn't prepare was he had like basically the same outline he educated into his class, and he's like, well, the paper has to develop the previous paper, right? Makes sense, like over the course. But there was no time to right, but there's no time to yes. The other one I didn't have any time to right. Yeah. Develop. Yeah. No, there's no time for that's what he kept saying. You need to like read other papers to develop these papers. He didn't give us valid information. So okay, so what's the most I think it was a bit of this.
Yeah.
Oh, of course.
Well, and
But that alone is
and then watch and read the lecture.
It was
I think the question before it even gets yeah, and then you see that there's a problem with something. Yeah, okay, so that was the identification. Formulate a policy, which was yeah, and I feel like I always want
but I think it's really think about
I think the four papers, third paper said, maybe it was a
I'm not sure if I remember anymore. One of the papers said that I didn't do X, Y, Z. And for my next paper, I did X, Y, Z. So for number 4, I did X, Y, Z. And then he said I did too much.
That's our grade.
Because you don't know what you want.
Like you spend too much time in this areas, you spend more time on specific.
Yes, exactly.
So you know, so like,
It should be like
She wrote the same thing. And you're like,
so not to take. Don't take class on
Not if you want to.
That's why we have actually. I took that last year from well, not during the spring, over the summer. I remember going back
Oh, really? Well, no, you know why? It's because there's more students in spring, so they can't grade as fast.
But he grades we all have to do discussions now. Because then he kind of stopped that because he realized it's not nice. Because it goes through email and so take it if it's not here. So
Okay, if you can try to spend 2 more minutes and wrap it up and assign somebody to report, because apparently the online students are having difficulty hearing you over the microphone, and we're sorry about that. Okay, 2 more minutes, assign somebody, and then we're going to sort it all out.
I don't care.
Like any problem solving
I'm trying to. I just feel like as soon as I'm for me, I like study.
Oh, yeah. Study abroad.
I feel like the front of the room getting a presentation. I like 5 like I have 4 extra units. I went in the summer, it was 2 weeks. And it was yeah, we did Gero. Yeah, I'm in that class. Did a recap first. And the Eastern Perspective project, someone Irish.
For you students who are online, people are trying to wrap up.
Probably what's big.
Yeah, so
This is the small groups. Around the room. Next time.
Oh, I emailed last time.
Look over the definitions.
Okay, whatever.
All the instructions, and we're going to have a discussion in just a minute. Students in the class telling us definition contributed, whether it last or left out, and how it compares to some of the others.
And then of course somehow I was supposed to anyway. Yeah, that's how work it out. He knows you better.
Is everybody just about done? Raise your hand if your group is finished. All at one time. What happens in here?
Haven't moved yet.
Let there be light. Okay. Hello? Who is speaking for group number 1, the first definition?
I guess I will.
Okay, I'm going to give you the microphone. Actually, it might be best if you come up here. The students online can see who's talking, otherwise it's just the talking head back there. Just tell me the name.
Oh, okay. My name is Carrie Donahoe, and we are discussing Anderson's definition, and he says that public policy and social policy is a purposive course of action followed by an actor or set of actors in dealing with a problem or matter of concern, and it focuses on what is actually done as against what is proposed or intended. And so we thought that what it doesn't do is it doesn't discuss anything about being in the public's name. It doesn't specify much about public policy, and is more of kind of a general, broad, blanket statement. And it doesn't specify an accurate means of assessing outcomes. So even if you're focused on what a specific policy does at the end, which is kind of the primary focus of this statement, it's really hard to see what a policy does at the end of the day, right? Because you can have a policy and follow it up 5 years later, and if it's focused maybe on children's health, you might look at it 5 years later, and it might be in the midst of a crisis that we're having, and it's very hard to see if it changed or not in the midst of a bunch of other compounding variables. But and what it does do is it differentiates pure and applied change, so it does focus on applied change, and it was inclusive of who is creating the policy when it talks about actors. So maybe figures.
Good. So you got a sense of that definition that tries to be applied. It doesn't really mention any particular policies. So we'll see how it compares to some of the others. So, who's speaking for the second group? You could come up, tell people who you are again, especially for the people who are watching online.
Hi, everybody. My name is Aaron Levy. We had the second definition. A process of problem identification, policy formulation, policy adoption, implementation, and evaluation. So our definition was a little bit vague, and it used the word policy twice to define the word. And we thought it was more of just sort of like a timeline of how policies are developed, not a real explanation or definition of what it was. Some of the major things that we thought were lacking was that policy is sort of the answer to a question about how do you distribute resources, a limited number of resources among a wide number of people. And it didn't really identify or speak about that at all. And it also didn't really speak about, in what type of a setting a policy was formulated. So actually, our definition was vague, and we found quite a few flaws with it, but I'm sure every definition is similar. Okay, I think that's it. Thank you.
Good. If anybody from any of the groups wants to add anything to your presenter, that's certainly fine. You might find interesting that some of the terms used in that particular definition, you'll find in the description of the paper that you're going to write with more clarification. But that is sort of a policy kind of process that I'm going to talk about in a few minutes. Third group.
Okay, I'm Alexis Denton. We had the McRae definition, and we thought that there were two important parts to this. The first part is the policy part, and the second part is the public part. So the policy part is a chosen course of action significantly affecting large numbers of persons. And the public part is, if chosen by government, is a public policy, typically involves more than the administration application of an existing rule to a single case. So, the important parts here is that it's a process to form a solution to some kind of problem. It's not just about the end game, but it's about the process of going through this. It affects a large number of people, has that in there, and there's some form of government in there. The last part, it's about modification and creation. So modification to existing laws and then creation of new laws or rules. We thought it was missing a lot too, like a lot of these, it was awfully vague, that it was missing kind of the how, what, why, and who. And the how is, we know it's a process, but we don't know how this process goes about, what's the starting point, what's the midpoint, what's the end point. The what is, it makes no mention to what the end point of that process is. The why, there's no reasoning of that it's for the greater good, there's no question about that. And then the who, it doesn't mention who these changes are for. So, like the rest, it's very vague.
Good. Anybody from that group want to add anything? Who's the next group?
My name is Patrick Beck, and we discussed Evelyn Burns' definition, which is the organized efforts of society to meet the identifiable need of or social problems of groups or individuals. So once again, we have another very vague definition. This one can really be inclusive of quite a few things, but it brought up a lot of issues. For example, with organized efforts. Well, in formulating policy, the efforts aren't always so organized, and the organization aspect seemed a little indifferent that it could be organized, but it might not necessarily be organized. Society, well, who is always really strong in creating policy? Is it always every American, or is it a lot of times the lobbyists and the big corporations? Who really comes into play with that? And it was kind of ambiguous on who would get a fair say for that. Then identifiable needs and social problems. Who's supposed to identify those needs and social problems? Everyone in society? Or is it select groups that create that society? So once again, is that the lobbyists? Is it corporations? Is it everyone? Is it blue collar? Is it white collar? It's really ambiguous as to who gets to participate, at what level they get to participate, and then how they organize those efforts. But on the bright side, it's a great theoretical definition, but the practical side is it can encompass so many different things that you kind of lose a lot on it. Now, it can encompass the strengths and weaknesses of other ones. So, for example, with Timmis's, that one was very specific, and you were kind of stopped from going any further than that. Whereas with Burns, you can really include just about everything in there. So, it's good and bad.
I'm Seema, and I'll be speaking on the last one, that's by R. Titmus. Deals with the redistribution of resources, social and fiscal welfare, taxes, education, and mental health. What I found positive about this policy definition was that it speaks about the outcome or the purpose of policy when implemented. Like it speaks about the right from education to health to management to the redistribution of the resources, whatever it is. And we also try to compare the one which the first one, the first definition is more of a comparison. Wherein we will what a policy actually focuses on and what it intends to do. So it's comparing between what it originated as and what it intended to do all the way. And Gero's definition speaks of a process. It speaks of the whole thing in happening, a process of actions. And Burns' definition, it speaks of the origin of a policy, which are the flaws which we felt rather in our definition, where it does not speak of how the policy originates. Wherein in Burns you see that several people coming together and for an identifiable purpose a policy is generated, which are not seen in our definition. Thank you.
Good. Have we missed any group? So, what you see is really a range of attempts to try to describe what policy is. who it serves, what it covers, what the process might be, who's involved in it, and it's almost impossible in one short sentence to come up with a definition of it that fits all types of situations. But it's important to recognize for some of these it depends on when the person came up with the definition and what they were involved in. So Titmuss was a very famous English sort of social economist. And he was dealing with, after World War II, the creation of sort of a welfare state in Britain. So he focused on things that were important during those discussions. And so his talks about redistribution of resources. Well, that's what the government after World War II was interested in. It was interested in having sort of a welfare state, as they called it then. They necessarily called it a socialist state, a welfare state, and getting more equality. So in his definition are those kinds of issues. Anderson's a little more vague because he wasn't focusing on really what government. His definition could work for the private or public sector. He's coming at it from a different perspective. Jones was really about the process. What is the process by which policy is made? But I think, as you pointed out correctly, he's not identifying what influences that policy and what the end of that policy might be. So as you look through these, I think you correctly identified. Some were vague. Some didn't really talk about what the policy might be. Some of them were very good at identifying at least the process of the policy. A few talked about public versus private, and some didn't mention that at all. One did talk about new policies and changing old policies. Several talked about the distribution of resources being a key element of what policy is about. Only a few identified, well, I don't think any identified who figures out what the needs are. Well, how is that done? And that can make a big difference in it. Some of them alluded to the different interest groups that might have an influence over policy. So I think you did a good job of sort of sorting through individual definitions. And I hope as you heard some of the others, you could see how writers and thinkers have tried to sort this out for themselves. But we shouldn't pin one little definition on an author and think that they succeeded or failed, because these are taken out of context. So let's move on and look at more broadly what policy is and how we thought about it over time. I'm going to move this up and down depending on what is the black. People can see it. For those of you at home, we're trying to make the screen on the right side. There it goes. So, those of you who are at home, I hope you sorted through the same policy definitions. You might have come to different conclusions about them, but I hope you were able to see the differences that exist among them. So we're going to start looking at start with the policy process. And to the right, you see a certain kind of policy related to pooch policy. And if you can't read it, it says, dogs may be on the porch, briefly. They must be attended, quiet, and controlled. This was not written for my dogs. Totally out of control. At all times, they must be leashed, crafted, or held in their attendant's arms. In the event of customer complaints, we'll ask you to remove the dog from the porch. These are sort of the outcomes of what a policy might be. Who, what, how to change it, what it might affect changes, in this case complaints. But in reality, the policy process does start with problem identification. But we don't always start that way, because we would like to think the policy process is rational and starts at a certain point. But reality is that's not the way it works. But it's helpful to lay these out anyway. The second might be agenda building beyond the problem. Policy formulation. Is it a piece of legislation? Is it a regulation? Is it a tax? What is it? How does it get formulated? Policy adoption, which if it's a piece of legislation means that somebody might have voted on it at one level or another level. Budgeting, which was alluded to in some of the previous definitions that you wrestled with. But budgeting is like, how much does it cost? And related to that is who's going to pay for it? And how are they going to pay for it? As we look through some current debates about policy, a lot of it is it going to cost? Who's going to pay for it? Who are the winners and losers in that process? Implementation. Implementation, as we're going to see, was not one of the early parts of dealing with the policy process. It was sort of left out. But in the last 30 years, we realized that just because something gets passed by a bill or a regulation gets put in place doesn't mean that what happens is what people expected. Something can go astray in the implementation process. We're going to look at that. Evaluation refers to going back and figuring out, well, is what was intended actually what happened? There's a lot of discussion in the literature about unintended consequences, which means you try to do one thing, but then something else happens, either in the implementation or the writing of a bill or the discussion about regulations. Things happen that you might not have expected. Some of them could be good. Some of them might be detrimental. And the last one is policy succession, which is a little like what we had up on the board, and which what was mentioned about changing the policy, going back and rewriting a bill, trying to figure out the things that didn't work and trying to correct them, maybe massage the bill so it better serves the intended people out there. So this is what generally is meant by the policy process. So let's talk for a few minutes about problem identification. So the policy process assumes a lot of rationality, and we can figure out, at least theoretically, how the policy process works and try to make it work as rationally as possible. So what is a policy problem? Can you think of a current policy problem that's under discussion and we're trying to figure out what to do? Or one that you've read in the past that pertained to older people? Medicare.
Should always be on the table.
So Medicare was initially on the table and is back on the table. And why? What's the problem that people are either concerned about now or were earlier?
They're having a lot of trouble with like Part D. Apparently, a lot of people found that very confusing. And trying to integrate that.
So we're going to look at Part D, and Part D relates to pharmaceutical medications that older people get that are partly paid for by the government. And we're going to see in there a problem that actually people knew about when the bill was passed. There's something called a donut hole. You all know what a donut is. And the hole related to the fact that people between about $2,500, who had spent about $2,500 on medications, the government at that point would stop paying and pick it up again after you would spend $5,000. And there were reasons for this that we'll look at later. This was clearly a problem, that there's this hole that people are going to have to pay for medications themselves. So we knew that was a problem. It was a compromise that we'll talk about later. And now the new Medicare bill is trying to go back and address that problem. So that was an anticipated problem. People are unhappy about it, especially those who are paying a lot for medications in that hole that they're in. And it's something that AARP, which we'll talk about later, and other groups want to see addressed. So there is an example of a problem. Was it judged to be unreasonable and unacceptable? Well, the compromise was they would pass the bill initially with this problem and try to get back and address it later. So it was one of those compromises. And the thinking was not that many people fell into this hole, what's called the donut hole. The donut hole is good because you have a picture of what that hole is like. I guess it would be worse if it was like a big hole in the ground or a cave-in, which for some people is what they really experience it as. The donut hole, that image is a little less onerous, dangerous than it probably was. So when Medicare Part D was passed, when Medicare originally was passed, there was no part of it that dealt with medications. There was no part of Medicaid that dealt with medications. And that was in the mid-'60s. And do you know why that might have been true? Why didn't they have a part of it paying for medications?
Didn't have as many medications.
There weren't as many medications there then. And the ones that existed were not that expensive. But in the 40 years since then, a whole array of medications have come up, and doctors treat a lot of people with many medications, and the cost of them has gone up. And medications are under patents that last for a long time. So if you needed something called Lipitor, medication a lot of older people use. The patents still exist for that drug, so you may not have any other choices. So something that the original designers of Medicare were not that concerned about has become a problem later. And now they made one attempt to solve it, and they're going back again to try to fix it. So it's appropriate for government action because medications have become an enormous part about how to treat diseases and problems related to health that weren't there before. Is there a government solution for this problem? Well, we'll see when we get to it. But there are ways to fill this big gap we don't have, but it's going to cost money. And we'll look at that. So how are problems defined? Well, you can see as society has changed over the last 40 years with this example, medications have become a bigger problem. And that's why Medicare Part D was passed when it wasn't initially. And this was done in a very political process. Republicans and Democrats arguing what should be covered and what the plan should have and what it didn't have. Is anybody here familiar enough with Medicare Part D to know the other big issue besides the donut hole?
Does it have to do with the pay-as-you-go part that George Bush eliminated?
That is part of it, but it's not the biggest issue. The biggest issue has been whether the government negotiates the price of medications with the industry. Pharmaceuticals are basically designed by very big drug companies. Most of them are international in scope at this moment. So they're selling their medications all over the world. And the original bill, the price of medications, the bill said was not going to be negotiated by the government. So basically it was what the companies could charge. And the companies claimed this was okay because we're competing with each other. And that'll bring down the price. It'll be a reasonable price. But you might have seen ads on television over the last couple of years where drug companies have been advertising sort of public awareness that if you have trouble paying for your medications, contact us, and we will try to help you out. And that's because a lot of people can't afford the price of medications because there were co-payments and the price is still high. And the Democrats didn't like this. They wanted to have price-controlled medications. And actually, there are the Veterans Administration, which has its own medical system, does negotiate the price of medications with the producers of it. And the VA, the Veterans Administration, is a government-run and organized healthcare system. So this is an issue that is still under discussion. And a problem that existed early on has only become a bigger problem because the cost of medications is still high for a lot of older people. So what would make this a public problem?
So many public citizens, so many
A
people.
lot of people are affected by it, so that's one. Anything else?
Paid for by tax dollars?
It's paid for by tax dollars.
The ability of the government to be able to affect it?
You know, the government to be able to affect it. And into this discussion have now come the groups that backed Medicare Part D, like the Alzheimer's Association and AARP. And we'll talk about why they did that later in the semester. But these interest groups representing older people are now back in the battle to reduce the cost of medications, not just the donut hole, but to get the government to control the prices, as the Veterans Administration does. We'll come back to that, just an example. So what made it a public problem? A lot of people use medications. The cost of medications is very high. That older people themselves couldn't do much about either of those except pay or forego taking medications. And at the same time, there's these very large corporations controlling major medications of importance to older people. Agenda building. So what is agenda building? So we've talked about an example of a problem, and there are many problems. How does it get on the agenda? How does it get attention? So for prescription drugs, how do you think it got on the agenda to start with?
Senior
citizens certainly concerned, family members concerned about people's ability to afford them. these interest groups that have been lobbying for a long time?
I was going to say insurance companies, but they probably just make money off of it. Insurance companies?
Yes.
Wouldn't they want to be on the opposite side of it to keep medications expensive?
Well, the drug companies would probably want to keep medications as expensive as possible. On the other hand, they want more people to use them. More people that use them, the more they sell. It's a trade-off between having the highest possible price versus selling enough of them that you make money too. Insurance companies sort of are somewhere in the middle. If they have to pay, if you belong to a health maintenance organization, HMO, and they cover your medications, which many of them do, they would rather have the cost at a lower end because otherwise they have to charge you more premiums. So they're out there trying to negotiate.
The physicians that prescribe these medication might care whether or not if the patient can afford.
Absolutely. Physicians, well-intended, they know that a medication is going to work for somebody and they can't afford it. They know that person's not going to be able to use them. And there were certainly a lot of instances of people, and you still read about it, that people take half the pills because they can only afford so many per month. Or they'll try to use something else that's they can buy themselves that they think is a substitute for it, or forego them completely. So the adherence for medications is not terribly high anyway. Doctors certainly, if they think that a medication is going to make a big difference for someone, would want their patients to use it.
It's also probably in the long term really costly if you don't, like if you can't afford to pay for antihypertensives and you end up in the emergency room having congestive heart failure. The long-term cost of that to the American people is really high.
That's a very good comment too, that there are consequences if you don't take a medication that can control something that is going to cause you worse problems. So it sort of falls somewhere in the arena of preventive health. If you don't do it, things are going to get worse. You'll go to the emergency room, you'll be in the hospital, and even more expensive treatment might be necessary. So there are a lot of reasons that this finally got on the agenda, but I must tell you, it took, from the passage of Medicare in the mid-'60s till 5-6 years ago for it to get up there. So in the meantime, during a lot of that period, people were struggling with that, and they still are to some extent. This says making it onto the government agenda does not guarantee action. So sometimes things will get on the agenda and be discussed forever. So when we look at healthcare, one of the early proponents of a national healthcare system in which everybody would be covered was President Harry Truman. And he became president just after Roosevelt died in 1944. And he was president for 2 terms. He was an advocate for national health insurance. Well, here we are, the year 2009, still talking about it. So it got on the public agenda for a discussion, but it never really got passed as a bill in its entirety, and we'll see why that's true in a few minutes as well. So some agenda items become more or less mandatory and some are discretionary. And when we look at those that are mandatory, can you think of why some might be mandatory? What is it that makes something mandatory?
There's a need for it right now. So some parts of the everyday healthcare, like Part D, was mandatory at the time because prescription costs were so high, whereas some of the other things, they kind of were covered under the old bill, so maybe not as needed.
Maybe mandatory.
well, if it affects everyone, then like the terrorist attack, how policies were quickly implemented without any with less red tape. If it's a very direct and dangerous thing that affects almost all the citizens.
So something like that could do it. Another possibility is when the Supreme Court of the United States makes a decision that something has to be done to address a problem, then it can become mandatory. The Supreme Court says you can't do something, or makes a decision that you have to do something. You can see some civil rights bills in the United States that ended up in the Supreme Court. The Supreme Court said you can't segregate, you can't discriminate. Things like that call for the government to do something. They don't always say exactly what it is the government has to do. They do say the government needs to either has to stop doing something or it has to start doing something. So the other kind of mandatory issues that come up in terms of amendments to the Constitution of the United States. Civil rights is another one of those examples, an amendment to the Constitution. So things that affect everybody, yes. But sometimes it takes some much larger movement than simply Congress debating with each other to get some action. So those are mandatory examples of mandatory. There aren't many that actually happens with. So here are some factors that can affect whether something gets on the agenda. We've mentioned some. One is definition of a problem. So we could define medications in some way that became a problem. We could define what a medication is. We could define how much the government would be willing to pay and how it would do it. Interest group efforts help. And we'll talk about interest groups in a few minutes. But think about what can you think about in the United States some interest groups that are either aging or non-aging? We know about AARP. Think of any other interest groups that are particularly strong. Alzheimer's Association is an interest group, even though we think of it as sort of a benevolent, kind organization helping people with Alzheimer's. It does lobby with Congress. Can you think of any non-aging ones?
Is Greenpeace?
Greenpeace is a lobby group. And we think of it, animals and goats and clean water and all that, but honestly it's out there fighting with other interest groups that might have different views and trying to get other groups on its side. Greenpeace. Any of you ever heard of the National Rifle Association? NRA. National Rifle Association is an interest group with a very defined agenda. And a lot of members who really think that has to do with the amendment to the Constitution of the right to bear arms. They are fairly powerful and organized and contribute a lot of money but they are extremely they're relatively small in number. They give a lot of money to politicians and strong believers in what they do. Political leadership. So we have a new president in the United States. There's going to be a new party takeover in Japan. Parties change in terms of power. And leaders come and go. Senator Kennedy's death, he was from Massachusetts, sort of leaves a void in the healthcare reform arena where he played a big role, and we'll have to see if there's anybody else who can step up and carry on in the way that he could, but it can make a difference. So who is president? Who controls the Congress? What party's in power, regardless of what country it might be? And who's on the Supreme Court? So what is the Supreme Court? Why do we care about that? What does it do?
The Supreme Court primarily defines, legislature defines.
It hears cases and deliberates, makes a decision about what is constitutional. That's its main role. And sometimes it's more active in terms of taking action, and sometimes it's more reticent. Depends on who's on the Supreme Court, but it can play a role too. So triggering an event or crises, that's what you mentioned, that something happens that compels us to do something. And when we look at aging issues, most of them, well, Social Security is an example of one that sort of the triggering event was what, do you think? Occurred in the 1930s. What was? Depression. It was a worldwide depression. Older people were strongly affected by it. Huge amount of unemployment. We'll look at it in a few weeks, but it was a defining event that allowed at that time for Social Security to pass against much opposition. It wasn't like everybody agreed this was a good idea. We'll talk about the history of it in a few weeks, but there was an event, and the question that people are talking about now is the event of the current, we don't call this a depression, but a lot of names for it. Recession, decline, anybody else here euphemistic terms? Everything but a depression, because the depression lasted for such a long time and it was worldwide, and it was unclear that what we did really got us out of it. So we don't call it that, but the question is the healthcare system in such trouble that at this point that we are willing as a country to do something major about it, or are we just going to do something incremental? So sometimes there are defining moments. Media attention. The media does play a role, and perhaps that probably plays a much bigger role now than it did like in the 1930s. In the 1930s, how do you think people got their news?
Newspaper, radio.
They listened to the radio. They could not watch television. It hadn't been invented. You can imagine that. But they could see things. How would they see things? Newspapers?
They went to the movies, there might be a reel.
If you went to the movies, movies included newsreels. Imagine that. Who would sit through a newsreel now? Newsreels, which are like little mini documentaries about an issue.
The mic is making feedback. Can you try it without the mic?
This is our monitor?
I'm sorry.
Okay, no mic. People would go to the movies and they would watch newsreels. And so terrible events would show up, like the crash of the Hindenburg, which was this giant air balloon. That was shown in a newsreel in a way that people could actually see it. Usually took a period of time for the event to actually make it out to movie theaters. But people went to movies during the Depression much more than they do so now. So half the population would go to movies. Apparently pretty cheap. So now there's this big debate about healthcare, and proponents and opponents of it are using every piece of the media that's available. Twitter, Facebook, conventional websites, and blast emails, and I mean, I get so much stuff about it through various parts of the media that I'm not that familiar with. It's like you can't get away from it. Changes in statistical indicators. Now, you would say, well, how could that make a difference? Well, I'll give you an example that we'll talk about later in the semester. But I'm involved in a center that deals with fall prevention. And we're trying to get the information out to older people, the medical field, and the government that falls are a serious medical problem and costly one for older people, and that about 11,000 older people die each year because of falls. Most people think of falls as accidents that happen to people. And we know that we can reduce falls, and we're using a lot of statistical information to try to make the case to a wide variety of decision makers that they should invest in fall prevention. That there are programs out there that work. You think that's sufficient to change people's minds? We've got pretty good statistics.
People don't necessarily always understand statistics either. They don't understand 2 out of 3 people because they know what 3 people are, but they don't necessarily get 72%.
So statistics, a lot of people don't get it because they haven't gone to graduate school. They get undergraduate statistics. You're all luckily going to take a course that deals with that. So you won't be among those. Any other reasons?
Sometimes if it hasn't happened to them or to somebody they know, they're just numbers, so they don't know how to make it their own.
So we're partly counting on the fact that so many people have older relatives, and 1 out of 3 older people fall each year, and 20% of those cause serious injuries, and falls are much more serious than auto accidents. People think of accidents, they think of autos. And whether falls are really accidents or not is debatable, but we know that if you look at the statistics, falls are much more serious than auto accidents in terms of fatalities and death and injuries. I think the reality is that stories probably count more than statistics. So we're always trying to get stories in the paper about falls that happen. So I think I mentioned we have on our website a list of famous fallers. Because a lot of famous people who have fallen. Pope fell recently. Nancy Reagan fell. Some rock star just fell off the stage.
Steven Tyler,
Aerosmith. So, you know, even Fidel Castro, there's a picture of him falling off the stage a few years ago. He just tripped and fell. And a lot of people, famous people, have fallen because they're older and the odds of falling are more important. But what we haven't gotten yet is like a champion. Someone who says, you know, this fall happened to me, and you know, you can avoid falls. A little ad on TV, a public service announcement. People have been after me to try to get Nancy Reagan to be the champion about falls. So far, nothing has happened. Statistics are important because they are evidence. But by themselves, they're probably not enough. But they certainly can make something start to get higher on the agenda than it otherwise would have been. And if people recognize there is a problem, they sort of validate it. They validate it. So you almost these days cannot make a good case for public policy without statistics. So all the studying you're going to do about statistics won't be for naught. That you know, all discussions about public policy include issues of how prevalent it is, for whom it's a problem, how much does it cost, what can we do about it. All those are fair game in the policy discussion these days.
Statistics are pretty effective, though, especially certain statistics like that 10% unemployment rate number, like certain numbers kind of carry quite a bit of weight.
They are. And the question is, Why are there benchmarks? Why is it 10%? Why isn't it 8%? During the Depression, it was probably closer to 25%. And that's why people say, well, this isn't really a depression. During the Depression, it was much worse. There was no safety net for people. So one of the questions is, what statistic is really important? It's 10%. Why 10%? Do you think?
Probably because it's an outlier. Sometimes not normal. Because I know other countries, like Japan, for example, I think they're just hitting like 5%, and they're all sort of.
So some of it depends
on
how you count. So there was a famous book, How to Lie with Statistics, that was circulating when I was a graduate student like you. And it wasn't that they were really lies, they just presented the material in other ways. So in a country like Japan, or even in this country now, there's undercounting of unemployment. Anybody know why that's the case? How do you get counted as unemployed?
Doesn't people who have removed themselves and have now in the unemployment?
If you're not searching for a job, actively searching, they do the surveys. So if you've given up, if you're a person 55, you've worked for General Motors or Chrysler, and you certainly know how to work in a factory that produces autos, and you are skilled at what you do, and you live in a small town in the Midwest, and you don't want to leave, you might give up. You're not searching. There are no jobs anywhere near where you live, and you're caring for your elderly mother, and you might just get discouraged and give up. You're not counted anymore. So there's undercounting of unemployment on a general level. Then the second thing is, how do we count people who work part-time? Are they employed? Are they unemployed? Well, what is part-time? How long does it last? And all these definitional issues start to enter in the discussion about any statistic. Any statistic. So in falls, if you look at national statistics, they might say only 20% of people fall, because the national statistics generally capture people who get an injury. So if you just fell in your own home and didn't get injured, that doesn't get counted. Even if you go to your doctor, if he doesn't report it as a fall-related injury in something to Medicare, still might not get counted. So there's a lot of discrepancy about definitions and statistics and what's counted and what isn't. So in Japan, who knows? Japan undercounting employment, or you may not know the answer to this, I don't want to put you on the spot. But there are a lot of people in Japan and other countries that have small little stores, and they're selling little goods, and they're somewhat protected in the price, but they can't make much money. They are still a nation of small shopkeepers, the way England used to be. And, they're sort of underemployed is how I would describe it. They're underemployed. They aren't producing a lot. They're certainly doing a service. But they must be eking out a living, because there are a lot of them, and they can't be selling that many things. In the United States, Walmart has pushed a lot of, Costco has pushed a lot of these people out of business. And a lot of those small little places are owned by older people. People, in this case, in their 50s and 60s, where doing a service and being in a neighborhood was a useful and good thing. So it depends a lot.
I think an important part of this idea of agenda building is to keep in mind that it's a competitive process. I think when we talk about policy, we tend to think that everybody's on the same side and that we're all trying to work toward this nirvana or this perfect society, but really the way that agenda building works is that there's limited space for discussion and limited funds for what we can put to things, and that people are coming at it from different directions. And if you have statistics, that's great, but somebody else may have statistics that for the opposite cause that are better or more effective, or maybe they've lied better. So I just think that it's important to recognize that this is sort of a limited resources type of scenario where people are sort of fighting to get
So
time.
in the area of falls, we're competing with every disease that's out there. Says, yeah, we're more important. We're the Alzheimer's Association. So we say, well, Alzheimer's people fall a lot. But there's not much we can do about a lot of their falls. But you know, we're all sort of competing, and that's why coalitions get formed. Coalitions of groups trying to at least come to some agreement. So there's a leadership group of organizations representing older people with about 30 members of it. And they get together and agree on certain issues they want to see on the agenda. So they lobby for it. They send letters to the Senate and the House and the President. They try to have a common stance because they know it's just one organization, even if it's AARP, is not going to be able to succeed in an arena that is extremely competitive. Extremely competitive. You would say, well, why are older people competing with Greenpeace? It seemed like they would all be agreed, but there are limited resources. How much money goes to clean up water and preserve animal life? And you wouldn't think it's competing with older people, but in fact, limited resources, everybody is competing to some extent with some other group. Doesn't mean that whatever Greenpeace recommends won't be in accord with what a lot of older people want, or that if older people are more healthy and well, they'll be able to enjoy things that Greenpeace is after. But in a strange sense, they are sort of in competition. It makes it really hard to get something way up there at the top. So something else that can help is political change. And we're experiencing that now. Democrats control the Congress. They didn't 4 years ago. They've got a Democratic president. In Japan, there's a new party, which is now the majority party, as I understand it. I mean, that's political change. But it doesn't mean you can still get your way. We'll see when we look at healthcare. But it certainly can be an impetus, along with some of these other things, to change a policy, get a new policy, fix a problem. Policy formulation. So we've talked a little about problems and how they might arise. But the problem-solving alternative, and the policy process often looks at alternatives. So as a student of public policy, I'm always thinking, my area is actually housing, and subsector of that is housing for older people. And I've been involved over the years with debates about what's the best way to solve the housing problem in general, and for older people in particular. And I'll give you an example of alternative. The easiest way to solve the housing problem, to some extent, for older people and for the population at large, because the biggest problem of housing is people can't afford it, is to give them enough money. Give them like a voucher that they could take to their landlord and pay for housing. That is actually the simplest way to do it. You don't have to build anything new. You don't have to say that a person only can live in a certain place. You can help an older person stay where they are if they can't afford the rent in a particular location. That's the simplest thing. But a lot of people don't like that solution because it benefits private landlords. How do we know that people are living in places that are in good condition? We don't want to pay for somebody to live in a terrible unit that's overcrowded and infested with insects and rodents. We don't want to pay for that. It's not in the public's interest. How do we keep graft from occurring? And some people argue what we need for older people actually is new kinds of housing. And For an older person to live on the 4th story of a walk-up apartment downtown LA, that's not a good long-term solution. They're not going to be able to do that. So we should build new housing. So you can see that these alternatives start competing with each other, and they're policy people on both sides of it. I think one is better. People who argue for these vouchers will say, well, it's cheaper. It's very expensive to build new housing. Not all older people want to live with people their own age. Why should we segregate older people into these buildings? People who build those say, well, we can provide meals, we can provide support, people will make new friends. You know, if they're in an apartment building with everybody else, they might be isolated and lonely and have nobody to help them. You can see that these alternatives start competing with each other. And when we get to housing, I'll talk about how it plays itself out. But as policy people who are versed in policy, we want to compare alternatives. There's not always just one best solution to a problem. There are usually 3 or 4 solutions that are pretty good, but they may have different premises behind them. So the voucher one is give people choice. The housing for elderly one is give them an environment that really works. So you can see competing ideas. So what we do sometimes, and we'll see that later in the course, is we try things out. We test them. So we tested this voucher program with older people and younger people during the 1970s. We actually had little experiments running around the country in like 10 places to see, you know, were older people going to do as well as younger people? Were people of color going to only pick places in their neighborhood and end up being segregated because landlords somehow would discriminate in other places? They sort of watched how these things worked. And then they sort of compared them to other solutions. And actually the vouchers did pretty well. Older people tended to stay where they were. That was sort of natural. But they reduced their biggest problem, which was how much rent they paid, which was a big plus for them, because then they could have more money for prescription drugs or beer, whatever they chose. But we actually tested that model, and we tested building senior housing. Senior housing wasn't for everybody, but the people who moved into it seemed to make new friends and be very satisfied with it. And not everybody chose that. Some people just literally wanted to live in more intergenerational settings. So is there a best solution? That's a question of public policy that in the United States is questionable. My own view, after having been in public policy on and off for about 30 years, is there's probably not one best solution, but there are certainly solutions that are better and some that don't work so well. And solutions that work well in one situation might change over time. So now, if you go out to, any of you rented an apartment recently? So I assume you got a better deal than you would have 5 years ago. Rents have gone down. Not in the U.S.?
Not in USC.
Not near USC. Well, you made a decision to live near USC. There's sort of a captive market here because people want to be able to walk. If you're willing to transport yourself, there's more choices. A lot of people do choose location. Location cuts down on your choices because you've made a decision that matters. And that's probably true of a lot of students.
It also depends on your location. Like Los Angeles is double my rent that it was in upstate.
Yes. So you know, housing is something that it's very expensive to live in New York and be an in-class person at USC. You could be an online student and live in New York. If you wanted to commute, That would be pretty expensive. Although sometimes there are students that do commute, like from San Francisco back and forth, places like that. We only have a few classes. But the point I'm making is the best solution can change depending on economic situations. So now there are many more choices for renters than there were 5 years ago. The rents were really high. We don't know where all those renters went, but probably went back to live with their families, or they doubled up somewhere else, or they moved out farther where the rents were cheaper and decided to commute. You see, but the situation has changed. And policy responses might have to change too. So there's not always one best solution, but there are probably better solutions. Some solutions have a certain political ideology attached to them. So I would say for the most part, conservatives, Republicans in the United States do not want the government involved in building housing for the population. They think that should belong to the private sector. So there are very few government-based programs that actually build housing. The few exceptions are one for older people and another one for persons with disabilities. But aside from that, the government will help finance housing, it'll give you benefits for buying a house, but it's not involved in the production of housing. That's not true of other countries, where the government is heavily involved in different political perspective. So there are certain sort of political views that determine what solutions might be best and which ones are more likely. So who is involved? Who is involved in policy? Well, we know the president is. And we're going to talk in the next couple of weeks about the role of presidents and what they can do to change policy. But keep your eye on Obama. See what he's doing. See what he's saying. See what he's doing to try to change policy. We don't want to talk about it today because we won't get through the rest. But think about it. You know, where is he speaking? To whom is he speaking? What is he speaking about? Who's coming to the White House? Where else is he going? Is he talking to Republicans? Is he only talking to Democrats? Some of the things are behind the scenes and we can't tell what's going on. And that's part of the problems of understanding policy, and that's why we read books that show us what's going on behind the scenes, particularly books of history. The governor. So governor of California is Arnold Schwarzenegger. He is a Republican governor. In the legislature, that's Democratic. So he has a really tough road because he can't get the legislature to agree with him. We had a budget, we still have a terrible budget problem. We had an impasse for months with no budget passed by the legislature. And people were not going to work at all in the state and weren't being paid. And it's still bad for a lot of state employees. Some people are furloughed, they're only working 4 days a week. And we have someone who works for us who's based in the Department of Public Health. And her boss isn't there on Fridays because that's the way the state is working. Well, all our meetings of our center occur on Friday. So she can't participate. She can't sort of go against the state policy. So we sort of have to talk to her at other times. So the governor and the president have some powers, but in both cases they don't pass the budget. The money belongs to the legislature. So they can come up with what they think the agenda should be of the state government, the federal government, but they don't have the power of the purse. They run the agencies that spend the money, but they can't allocate the money. That's the separation of powers that we'll look at later. They don't have complete power. Government agencies, what power do they have?
Reinforcement?
Enforcement. They carry out laws.
Specific duties?
Specific duties. Any of you ever encountered government departments that you found difficult to deal with? Which ones?
The EDD, unemployment.
Employment. DMV, what were the problems at DMV?
Everything. Making an appointment with them, actually getting in and waiting in line, and I went to take the pertinent test, they graded with the wrong key.
Those similar problems that other people have experienced. Yeah, the DMV is actually better than it used to be because, well, no, now it's gotten worse because they're furloughed too. So most of them are closed on Fridays, and a lot of the offices don't deal with many things anymore. But before, you couldn't even make appointments. So you would just go sit there. You would wait. You'd have to count on a whole day being spent at the DMV. It's sort of the epitome of what people think of as a bureaucracy. People are bound by the rules. They don't make exceptions. They don't want to hear your story about why you lost your license and that accident wasn't your fault. And yeah, you have insurance, but you don't have your card with you. But your mother has it. And they are not interested in the stories. They just are there, especially with so many people coming there. So not only do you have to go once, you might have to go back 2 and 3 times to bring all the stuff in that you want. And they tell you not to mail it because you get lost. So yeah, that is the example of sort of a rule-bound bureaucracy. On the other hand, bureaucracies were intended for a purpose. They were intended to have rules, to treat people fairly by rules, so that they wouldn't differentiate between people. They wouldn't do you a favor because you had a sad story that they might have been sympathetic to, but they have rules that say, what kind of information you have to bring. What is the evidence you have to show? What do you have to do to pass the test? Can you survive waiting in line? But those rules are there to be efficient, and it may not be very efficient, but also to be fair. Because before that, if you think about other places, and maybe other countries, where the person there is making decisions based on if they like you or they don't like you, or they like your story, or your story is sympathetic, and the best storyteller gets by, or you know somebody, you know their cousin, it's even worse, or their grandmother, or you have money. Money, yes, corruption. I don't know that anybody at the DMV, to my mind, has ever been accused or accepted a bribe. I think if you try it, you're in serious trouble, because there's so many people there watching. It's not like I can do it in private. Everything at the DMV is on cameras and, Yeah, exactly. So there are reasons for that. The reasons. This is not to justify how the DMV operates.
I was thinking that these sorts of governmental agencies and bureaucracies are really the key players in terms of implementing policies when they finally do come out. So early on in the process, when you're talking about looking for solutions and policy and formulating a prospective policy, these agencies would be important in terms of knowing what has worked in the past and maybe having more insight into what could work in the future. They're sort of the in the trenches people who...
That's what Bernard says is exactly right. That we could pass a bill about who can drive, and some stipulations about you have to take a test, and you have to take a written test, and if you haven't taken a driving test, you have to have one. You got to be able to have decent vision. But it's the bureaucracies and the agencies that write the guidelines. They write what kind of a test. And older drivers, there's a serious discussion about should older drivers take more tests? Should they be forced to do more driving tests? Is that discriminating? But can we have more performance-based tests about driving? Because even though they don't cause most of the accidents, older drivers get a lot of attention. So all these play themselves out in guidelines that come out of the agencies. These are not in the bills that are written. The bills are sort of general and broad. They lay out the general framework for something. But it's the governor and the agencies that end up writing, or the president, because he's the executive over all the agencies, the federal agencies, they write the guidelines. So what the guidelines are comes out of that. And they're the things that really become the rules by which the agencies run. And they can rewrite them. They can go back and rewrite them if they find out that they're not working, without necessarily going back to the legislature, unless it's a really big issue. I know that if they try to change drastically how older persons are tested, and that someone in the state legislature, it's not something the president would deal with, will there'll be discussions in the state legislature because it's what we call a hot potato. Nobody wants to hold it. There are so many things. It's got so much emotional connections to older people and their families and to the public that it's not just going to happen very quickly. So presidential organizations, well, they're parts of
I think that, I'm not sure either, but I think it refers to the agencies under the president, like the Department of Health and Human Services. I'm not sure. I think
and there are other ancillary things that the president is connected with, and the legislature, that have to do with budget issues. Legislators, we know who those are, the people who make the laws, and interest groups, we talked about this. So this was about the groups involved in policy formulation. The same group, for the most part, are involved in adoption. The legislators, they clearly make the laws, they enact the laws, pretty obvious. The executives, they also could, executives, especially the president, can have an executive order that sort of commands something to happen. And there are various ones that have occurred. You can have an executive order related to, there have been some recent ones. Well, the president could have an executive order that he actually could say to us that one executive order could be, he's going to institute a draft. I think that can be done by the president. I'm pretty sure. National emergency. We're going to have a draft. It happened around the Vietnam War. He could, the governor could issue an executive order that none of us can use more than 5 gallons of water over the next week, because of a serious emergency of water problems related to the fires. I mean, there's certain things that they could do certainly under emergency situations. Administrators, as we talked about, interpret the laws and make the guidelines. And the court can issue orders too. The court can issue orders. And it has about things that things should be done. So there are theories of policy adoption, and they're related to how do we make decisions about policy, how do we choose among alternatives. Bernard said we look at alternatives. Well, one of the models is called rational comprehensive. That's the one that we study a lot in the field of policy. We try to lay out the options figure out which ones are going to do the best job, which ones are going to be the most cost effective, and we try to narrow them down to just a few. And there's a whole science of this, rational decision making. Some of it's in this book. But it's basically saying, well, what's the problem? And what are the alternatives? So let's take the problem, let's take a different problem. Let's say the problem is 20% of older people are malnourished. They're not eating, getting enough good food. So what do you think some of the alternatives might be?
Food vouchers. Vouchers?
Vouchers. For what?
Food stamps.
We used to call them food stamps, yeah. They used to be sort of look like little greenish-like stamps. Go to the market, and for those food vouchers, you get sugar, you get cereal, you get rice, you get meat. You don't get some things. You don't get cigarettes.
No beer this time.
No alcohol. A bunch of things you don't get. But you can use it for a wide range of things. So what's another alternative to people being malnourished? You're not having enough food.
Food banks. Food banks.
Food banks. So what's a food bank?
It's kind of like a warehouse where you can get food depending on.
So it's a place you go and you can get food. Those exist too. There's one in LA called SOVA, which runs them around different places, and actually older people can come there, and some of them it's other groups getting bags of groceries to give out to like somebody in a church or a mosque or a religious temple. And sometimes those groups have their own food banks. That they collect food from people or they get it.
It's usually donated.
Donated, a lot of it's donated. So there's the second alternative. So one, you give people money. Second, you distribute food. Anything else? Any other?
Meals on Wheels.
Congregate meals. Congregate meals? Okay. Congregate meals, what are those?
Like a dining hall where you go and have a meal, a hot meal prepared for you.
That's what I had in college.
Meals on Wheels.
Congregate meals. So you go to a place and you have a meal together. What's the advantage of that?
Well, usually it's based on donations, so it's cheaper, and then you can socialize and interact, and I think there's nutrition guidelines they have to follow.
So nutrition guidelines. So people have to eat the food there. Actually, most of them are not donations. Most of them are funded by the Older Americans Act. We'll come to that in a few weeks. So most of them are actually funded by a program for older people. And you might get socialization. You might get a little talk about how to prevent falls. So other things happen there. Who said home delivered meals?
Meals on Wheels.
Meals on Wheels. So why is that a good option?
Because most older people don't leave their houses. A lot of them are homebound, or it takes a lot of energy to actually get out of the house.
So it's for people who are somewhat homebound. They can't easily get to a congregate meal site, maybe. Maybe shopping for them is really hard, or even if they shop, preparing the food could be difficult. So here we have 4 or 5 solutions. And so you can start putting your head around it. Well, which one works for whom? Which one is more efficient? Which one gives people better choices? Which one do older people prefer? Well, which older people? So you start seeing that the decision-making process is not so simple. All of a sudden, you have at least 5 solutions to the problem of malnutrition, and I'm sure there are many more solutions too. Education, educating people about what to buy, how to shop. Or maybe you get to
probably some nutrient supplements. I mean, like vitamins or.
You could have nutritional supplements
because it's malnourishment.
Yeah, for people who may not be getting enough vitamins. Which certainly can be true of all the people who are eating a very limited diet or maybe deficient. So it starts to broaden out. So if you were in the administration on aging, and you were in charge of nutrition, and there weren't programs, you should go through a process of thinking about it. In reality, not all of them serve the same purpose, and honestly, we have all of them sort of coexisting now. But if you need to put more money into nutrition, you got to figure out which one. So that's sort of example of rational decision making, which all of us as intelligent policy wonks that we're all going to become want to think about. So that is trying to figure out what is best, or what combination in this case is best. It is not so simple. And again, like, remember we talked about the housing voucher program? Well, there were a lot of experiments initially with food stamps and home-delivered meals and congregate meal sites, testing them out. But over time, each of them gets its own group of backers. I wouldn't exactly call them interest groups, but proponents. So now that I've seen that the food banks are saying we're not getting as many donations as we used to. But we have more people coming. What do? We need more money. Well, home delivered meals programs are saying, we're in the same boat. More people need them because the population is aging. More people can't get out. The congregate meals programs are saying, well, if we had more transportation, we could get more people to our sites, and people really get a lot out of it. The same people who are in home delivered meals, maybe they could come to the congregate meal site. So there's a lot of dispute and arguments about probably not what is best, but what is better and what is feasible. Incremental. So comprehensive, you get the idea that you lay out things, you look for costs and benefits, you look who's going to benefit and who isn't. You look at the efficiencies, you look at preferences. Incremental does that too, but if you follow the healthcare debate, and I hope more of you start paying attention to it, because it's like an open laboratory for us to look at through the semester. Obama had a couple of plans. One was to have a public entity as a competitor to all kinds of other health plans. That's one example, probably the biggest one. And he was making the case that this is the only thing that was going to bring down costs. And this is an essential piece of it. And now there was an article yesterday in the paper with Senator Kennedy's death and the rising deficit. We have an enormous deficit in the United States caused by a lot of different things. Can you think of what those might be?
9/11.
9/11 security.
The war.
2 wars, at least. 2 wars. What else?
Tax cuts.
Some tax cuts, although some people think taxes are still too high. Terrible economy with not much revenue coming in, much less revenue coming in to the state and national government. And then all these bailouts, various entities. So we're running a big deficit. What's a deficit?
When you spend more than you have.
Spend more than you have. That happens to me every month. You can only keep it up so long as an individual. Tap all your relatives and friends, take out loans, but it catches up with you. But in the government, what happens?
You borrow money from other countries.
We borrow money from other countries, China being one of them, and we push the debt off on the next generation of people, or hope that the economy rebounds to such an extent that the deficit starts to get paid off. And that did happen when Clinton was president. We were actually paying off the deficit. The economy was booming, and it's gone down. So we want to watch No, the point of this is that this article said that Obama might back away from trying to get the entire health care reform bill paid because of all these other problems, and that he might only do it what's called incrementally. What does incremental mean?
Little by little.
Little by little. And in some ways, the example of this happening was Medicare Part D. So that donut hole I talked about, that wasn't because anybody, even President Bush, wanted a donut hole. Just that he didn't think there was going to be enough money to pass it for everybody. He wasn't doing it for mean. There just wasn't enough money. And the only way that his administration could figure out how to pay for it was donut hole. So it was sort of incremental, and the people that backed it, including the Alzheimer's Association, the ARP, they thought, here's a chance to get it passed, we'll fix the problems later. So they sort of saw it incremental too. Only now it's harder to solve because all the other economic problems that exist. So incremental means sort of one step at a time. One step, take another step. Sometimes you end up going backwards though. You can't solve the problem, but you hope that you'll be able to speed up, when something happens and make some inroads on a problem. And for the most part, policy in the United States is probably incremental, with some exceptions. And we'll look at those in terms of Medicare, Social Security, the Older Americans Act, somewhat Medicare Part D, things that are so big and make such a giant difference that, yes, they had to be fixed, but the passage of them was more than incremental. It was what you might call a watershed. After Medicare, you can't go back to no Medicare. After Social Security, you can change it, and we'll talk about a lot of changes, but you're not taking Social Security away. It's embedded in how we think about older people, retirement, medical care, income security. You can change it with incremental things, but the passage of it in the first place was monumental. So those are different kinds of things. So the reality is the last one. What policy people call it mixed scanning. And we try to come up with the best ones. And we try to think them through. But in reality, what ends up passing often is something incremental. And that's why in the Congress and in state legislature there are committees. And the committees deal with legislation. And they're often dealing with fixing legislation. So things coming back to them. So an example that I was involved in was housing for seniors. Housing for seniors is a big success. Subsidized housing for seniors. But what happened over time was that people got older in this housing. People were 60 when they moved in. Now some of them are 90. Some of them are 100. So they aged in place, is what I call it. We'll describe this later in the semester. But the housing wasn't working. It didn't have services. It was meant for people who could make their own meals, who could go shopping, who could get themselves to the doctor, didn't have to go to the doctor that often, who could get up and down the stairs, who didn't really need very much assistance. Well, over time, we succeeded. They grew older. They survived. And so now, what to do? What do we do? Do we force them out? No? Push them out to board care and nursing homes? Out of the places that they've lived? And these are poor people for the most part, people with very low incomes. What we did instead, a friend of mine was involved in this legislation. We added service coordinators to almost all that housing. So it's like, who's in social work school here? So it's like a social worker. usually it's not a social worker, but there's often a social worker overseeing a bunch of these service coordinators. And service coordinators are there to watch out for people, to arrange services, to make sure that if someone's declining, that the manager of the housing knows about it, to get meals for people if they're not connected with them, to make these arrangements. They're coordinators, but they also do sort of informal assessments, and we'll send somebody to get a more formal assessment, like a social worker. So we added these people to about 3/4 of the housing. That was incremental, and it took years. These people were aging and they were causing problems, and some people had Alzheimer's, and the managers who were not trained social workers, they knew how to keep the place up, were tearing their hair out and frustrated. Example of incremental. Maybe we should take an 8-minute break.
Yeah, no, you don't have to pick your exact place here.
Yeah, but just which.
Yes. And we can go to the same place, right?
Yeah.
Even though we're
You said you'd rather if
we can. Okay.
Well, let me see.
no, this is just the weeks.
Here. Someone already picked a non-profit or something.
Okay.
Everyone else is.
A lot of assisted living
Okay.
facilities.
I would tell.
I'll be in class.
The law firm. 8 minutes.
That's true. Actually, yeah.
That sounds really interesting.
Okay, let's do that one.
I just noticed right
Okay, so let's do that one.
Is that the stairwell that's right next to us right there? Can I take that downstairs?
Do you want me to email him?
What are we telling? Are we telling before class? Or do we have to know by Friday? Do you want
He said just email him because they sooner than later because it's first come first served.
Oh, okay.
So I'm not sure where she wants. Just that the two of us are.
No, actually, I'll do it after this. Or should we just do it now? I don't even hand out that email from them.
It was in.
That's just the class structure.
Yeah, it came after that. Yeah, that was first. The cost register was first. Okay. Oh well. Start a new one.
That's nasty. Get a Brita.
No, I don't know. I want to like take it out and look at it. Frame it.
What do you want?
Wow.
And direct deposit.
Yeah, we're sitting.
Not bad.
That was bad. That's terrible.
Oh my God, it's so.
I don't even understand when that project was made. But that is a long one.
Oh, you're saying
Oh no, I'm just not getting it. Did you have it late? Yeah. I didn't know. Yeah. It's Friday. You up? Would you have your fields?
I do have to on Mondays.
Okay. I had a class. I didn't take this obviously last year.
Oh, so you do Friday all day?
They would go for 10 o'clock Friday.
Yeah, really? This weekend?
Weekends. Mondays are long.
I guess
I do have haircuts. It's perfectly okay. Good morning. I see you bring out the right.
I've been sitting as low as this thing goes because it dropped all the way. I didn't see where the lever was. I was feeling around all around the basement thinking it was going to be in the front. Oh, it feels so much better.
oh, that's how I feel. I'm like,
Yeah, I was
wait a second. I'm like,
when I was writing that here.
Normally it would like play around, but.
But you took it on me last semester.
Things every day that it's down.
Yeah.
I did too. It makes us
Yeah, I used to get a cup of coffee.
Which one did you take?
Jim DeVera's office. I didn't know how the coffee machine worked.
Oh, okay. That's right. I tried.
7:30. Isn't that so?
That's right. I remember that now. Yeah. Shoot, we don't pay attention to any of this film.
Yeah, I know.
It's proof. Somewhere they're falling asleep.
Being recorded stuff.
Right. We don't need that.
I've seen those it's like Senseo. It's like a circle thing.
When you talk to me, it makes sense. It's like I'm always afraid to go into his office.
So like when I went up there,
There's always something in there. Actually, I got in there today. Outside of the
can you do that actually? Can you watch something right now? That's crazy.
There's online students that watch it.
How do you do
live.
that?
Or go to our class.
Oh, that's the, yeah. Actually, I had a question.
It's going to say intermission right now. On the it says watch lecture and click session 2.
So let's continue this policy journey. We talked a little about how things make it on the agenda. We talked about roles of different parts of government. Budgeting is a key part of policy making. It is the one thing that almost every program runs into. How much money is going to be allocated for any different efforts. And this says very simply, a policy without funding cannot be put into action. You would say, well, that's obvious. But what happens often in legislation is something that bureaucrats or agency directors call unfunded mandates. Unfunded mandates. So if something gets passed, they say that there should be a caregiver program for people with Alzheimer's, or there should be a hospice program that works in-home, or there should be service coordinators. And the legislation gets passed, but it is unfunded. There's no money that comes along with it. And when we look at the Older Americans Act, we will see that it has a very broad mandate of things that it's supposed to do. And every year, more and more things get added for the Administration on Aging, which administers the Older Americans Act, to carry out. But very little new money gets put in. So all those things that are already competing, it's hard to get the money away from them. And the new ones get very little or almost none sometimes. They get a demonstration. Like I was saying, it's important to test things. They'll get a demonstration instead of a real program. So the budget is key. And there are separate, as I said, eventual budgeting. A budget is proposed by the president and by the governor, but it's really the responsibility of the legislature to pass a budget. And that's why it's important to understand as much as you can about fiscal issues, what things cost and what impact it would have. So the president of the United States conveys his program priorities in the annual budget presented to Congress. So it's not something you want to read late at night, because it is like this, and it is full of numbers. But if you want to look it up on a website just to get a page out of it, you'll see it's extremely detailed, but hard to figure out. $10 billion is allocated to the Department of Health and Human Services for health care related to older Native Americans. I'm making this up, but you'll see like a line item in there, but it's to know what it really does or is, you have to go back somewhere else. There's no real description of it. It is almost entirely budgetary. It's like looking at your checkbook. Like you said you went to Macy's and you went to Good Food, but it doesn't tell you what you bought. It's just the little amount that you spent. There is the Office of Management, it's not the budget, that oversees the budget and works on it for the president. So when the budget gets to Congress in the United States, it ends up with the Congressional Budget Office. So the president has his own budget group, and the legislature have their own budget group, because they have really different. The president's responsibility is to present a budget, and Congress has to actually pass a budget, and it's not always the same budget that the president presents. For example, I'm sure Obama had put a lot of things in his budget related to the reforms he would like to see happen. But if they don't happen, Congress certainly isn't going to approve them. And if the economy went bad again, they might approve different things. The situation changed. So they're looking at it through two different lenses. So there's a budget group, and then there's the authorization committee. Now this may seem a little arcane, but the authorization committee actually says how much can be spent. So in spite of what's in the budget, they actually have to approve the amount, and then it has to be passed by the legislature itself. So this little quote at the end says, "No money shall be drawn from the Treasury." The Treasury, let's think of it as a giant piggy bank. But in consequence of appropriations made by law. And who makes the laws in the United States government? It's not the president. It's the legislature. So the legislature in the United States has responsibility for the spending of money. Implementation we already talked about. It's the bureaucracies, and the courts that influence them, or the legislatures and interest groups. We already talked about this. We talked about what agencies do. They make the rules, they adjudicate problems, they're there to enforce laws, and they run the programs. Evaluation isn't something that's always done very carefully. But as people from the social sciences and the policy sciences that we are all going to become in this course and other ones you take, how do we know if something really works? How do we know? So a lot of programs get passed with no testing, just an idea. They get passed. No, very little testing, whether it's going to work or not. And ideally, we should go back and evaluate. Did they work the way they were intended? Did they have problems? Should we fix them? So it's the agencies usually that are responsible for doing these evaluations or contracting with other groups to do that. So there are a lot of evaluation companies. I worked for one called Apt Associates in Cambridge, Massachusetts for a while. It still exists. And basically what they do are evaluations for the government. You would say, well, why doesn't the government do them themselves? They don't have enough staff with the skills, and evaluations come and go, and they want them to be non-biased. So they contract often with outside groups to do the evaluations. So they did the evaluation of the housing voucher program to see whether it was working, for whom it was working, with this firm made up of people whose lives were spent thinking, evaluating proposals. Basically, economists, social scientists of various types. My background was urban planning. I knew about housing, but there are a number of companies around the country, often connected with the universities, who do these evaluations. With and it says non-systematic, more impressionistic. The best ones are actually systematic. Nevertheless, if not enough money is given, they do these more interviewing the participants, interviewing the people who run the projects, interviewing outside people, rather than measuring all the outcomes. So if it was a meals program, you would want to know, did a person's nutrition improve? Right? If it was hospice, what would you want to know in hospice? You want to know, did it reduce people's pain? You know, did the families feel better about it? Did the person also get care when they needed it? You think about these outcomes out of every kind of project that might be run by the government and try to measure it as best you can. It doesn't mean that the program will change or end or necessarily because there are other forces that affect it, but evaluations are often brought up at congressional hearings as evidence of something working, needing to be fixed, or not working. So I mentioned intended or unintended consequences. Unintended consequences, again, are those things that happen that weren't expected to happen. Spillover effects, that something spills over into another program. So example, once we had these service coordinators in housing, doctors were hearing more from people who live there, so their caseload probably increased some because somebody was sending them to the doctor, noticing that they weren't doing well. Probably more people going to some of the meals programs because the service coordinator could tell people weren't coming back from the grocery store in many groceries or weren't even going. So it can have a spillover effect into another kind of a program. Consequences on future, well, I gave you that example in housing that we built housing for these independent people, we became dependent. Wasn't thought about. That was an unintended consequence that we should have known what was going to happen. Didn't think it through so carefully. So I just mentioned this. Careful reviews, none. Policy succession. So if you're in the policy world, and you're thinking about policy, you don't want to just think about the policy that you're working on at the moment. You want to think about how it's going to play itself out over time. And you want to be able to respond to it. Some programs start and end. Another one I was involved in was creating sort of new cities in town. The idea was a lot of old cities had sort of deteriorated, that they needed to be changed, and that what the government could do to bring back jobs to create new parts of those old towns as new cities. Huge redevelopment projects, of which there's some in LA. One in LA is in Bunker Hill. Anybody know where Bunker Hill is? Sort of near the downtown. Huge redevelopment. They tore out the entire part of that city downtown. And guess who lived there initially?
Low income.
Low income people. Low income poor people lived there. Anybody been to a baseball game? How many of you have been to Dodger Stadium? So guess what was in Dodger Stadium before?
Chavez Ravine.
Chavez, and who lived there? Low income, a lot of people of color. A lot of Hispanics and working class people lived there. It was determined that we needed a stadium more than those people needed housing. But new towns in town had a better idea, but nevertheless, they experimented with it. It was so difficult to do for the public sector to play that role. It ended with almost no new towns in town being built. It just was infeasible. So as I said, the major policies and programs probably won't be repealed, but they're going to be changed. And when we think of policy, we should think about it over a longer time span than we normally do. And why doesn't that happen? It's partly because how long does a senator in the United States serve for?
4 years.
6 years. That's a long time. How much is a congressman? How long is a congressman? 2 years. Congressmen are always running for office. Some have no opposition. Congressman Waxman, who's my congressman, is very influential these days. Nobody ever runs against him. It's a waste of money and time. He's just very popular and entrenched. But a lot of congressmen are running all the time, so senators every 6 years. They have a short time horizon. Usually not thinking about what's going to happen in 20 years. They're thinking about, okay, what can I do to at least make my constituency happy so I'll get reelected? Doesn't mean they don't think of other things. But on a lot of issues, it's trying to please their constituency and people who support them. So they last, so it's not entirely constrained. We're not thinking down the road. When we get to Social Security, I'll tell you how that played itself out. It's an interesting story. So this thing at the end says the longer programs or agencies stay alive, the less likely it is to be terminated. Why? Is that a truism? Is that true? Do we ever end programs?
Didn't we get anyone during the Clinton era? Didn't we get rid of more long-term welfare?
Well, Why would they the longer more likely? Because they build up constituent group. So now we have a program for caregivers funded by the Older Americans Act. It didn't exist. It's likely to get more money for this next year. Once things get started, like the congregate meals program, actually some congregate meals programs in senior centers are doing so well. It's not clear that people want to go to them anymore. In some locations, they seem sort of old-fashioned. And so they have the same, 20 people showing up. Other ones are like in Culver City, they're really popular. So what happened? Well, we're not sure. Shouldn't we close the ones that not many people are coming to? Probably. Will we? Unlikely. We know we can give meals in other ways. Why do we have all these people coming for meals? They consume the biggest part of the Older Americans Act. Well, people are used to it. They've got a whole network. They're providers. There's not that it's doing anything bad. Maybe there are better things for the money to be spent. But it's very hard to change something that at least is doing good, but to change it for something that might do better. Things get entrenched, and they have a constituency, they have a profession that follows them, there are organizations of people who deal with congregate meals and senior centers, and it's very hard to change things that have been there for a long time. Sometimes it happens. Later,
I don't know whether it's relevant, but I heard that they have stopped this dental insurance for dental treatment.
for dental treatment?
Yeah. So, like, they were giving appointments before July so that we can finish up all the treatments before this topic.
Some of that is funded by state money. And the state is in such a budget deficit, they're cutting out. This is a situation where something's changed. They're cutting out the Healthy Children's program that they have. They're cutting just people. They're cutting programs like dental care for older people. They're reducing the number of days a person can go to daycare. They've reduced the funding to the Caregiver Resource Center in this building. And we can talk about later why this is happening, particularly to programs for vulnerable and poor people. Remember our discussion about definitions of public policy, who it's intended to serve. But a lot of these vulnerable people are losing the services that they have. It's short-sighted, probably, in my view, because people who aren't getting things are going to end up in emergency rooms. You can't turn them away. But this is sort of a fact of life at the moment. So you're correct. Things can end. Maybe it's programs somebody didn't like anyway, but maybe it's just because the brush was across a lot of programs. And that program did not have enough defenders, or wasn't seen as needy enough, or cost some money, or whatever reason. That's a very good example.
There are so many people who are coming to dental school even here, and now they have heard that there is no insurance anymore. They just go back because they can't afford even consultation.
Oh, okay. Because our dental school is known for giving free or very low-cost care if people need it. Dental care is not paid for by Medicare. There are other programs that pay for it. I was telling you, we've got to keep going. So we've covered some of these theories because we've already discussed them. So we've covered rational choice theory, right? You look at alternatives, you think about what's going to work, you test it out, you figure out the best way, you got that one. We look at each of these comes up. So we also looked at stages of policy, identifying a problem, what gets on the agenda, how do you pick something? Well, if you're rational, you pick the best one that does the most for the people you want to, at the cheapest price. Doesn't always work that way. Something gets enacted, something gets implemented down at the Department of Motor Vehicles, and it gets evaluated by its consumers and not doing a very good job. I could judge by comments here. Hi. Does it go back and fix the DMV? Now without more money. In this case. So what is political systems theory? So political systems theory is a little different than rational decision making, where you're looking for the best policy to make the decision. Political systems theory says, look at the broader system that's affecting things. And here's where like a broad-based education in gerontology is useful. Look at the social, economic, and even biological aspects of things that are going to change lives of older people. Think about those. Just don't think about policy. So think of all the things we've learned about aging in the last 30 years that should affect how we think about policy. So now, any of you taking biology of aging or a course like that? People are very interested in inflammation and how that affects older people's lives. Things that happen to you younger will affect your life as an older person. Well, we weren't thinking about that 20 years ago very carefully. So that says if you want to improve the lives of older people, don't wait till they're old. Think about it when they're younger. We know about diets and heart disease. So we should be thinking about how to affect what you eat and how you exercise and what your lifestyle is like, because that will have a big impact when you get to be 60, 70, 80, 90, and 100, or your ability to get that far. So thinking in the broadest view about the environment. Thinking about, how the larger environment affects people's health. We know that living in Los Angeles for an older person, aside from these fires, can't be that good because we have high levels of smog. And smog carries pollutants. And a lot of older people have lung problems. And how much that is caused by smog, how much contributes to people who have emphysema, we don't exactly know. But this wouldn't be the ideal place. On the other hand, you're unlikely to slip and fall on the ice here. You have to go up somewhere in the mountains to find it. But thinking broadly, thinking instead of narrowly just about how do you deal with the nutrition problems of people today, you think as broadly as you can about the lifespan. It also thinks about, what values that we talked about last time are going to affect how we design policy. Is this an era for the public sector to make a comeback and have a bigger role in people's lives because of the economic problems? The private sector was probably the main vehicle looked to by the Republicans. Is that going to change in Japan with the new, less liberal party? Are they going to look differently? Maybe not to the government. There are waves that affect different societies. India's become much more privatized in terms of the impact on the economy than it was 20 years ago, and more international. And all these things affect even aging policies. So if we think about political systems theory, you think about the inputs related to the environment, when we think about the political system, when we think about the outputs. This is very simplified, but it's broader than simply looking at the policy itself and looking through the alternatives. It's thinking more in the long run and more about other factors that are going to influence policy. Most people who work for agencies, as the federal government, don't have the ability to think like this because they're there to implement laws and get new policies going. This is the kind of thinking you hear more from universities and places like the Brookings Institute and the Urban Institute and Cato, ones both on the right and the left. They think about these things and try to influence policymakers about it. Interest group model. We talked already about interest groups. They struggle to influence policy. And one of their ways they do is to get access to talk to politicians. So if you are a big donor, you are a big drug company, and if your factory is in Indiana, and you have 30,000 people working for you, the odds are that your congressman and senator is certainly willing to talk to you about the importance of their company for the economics of your state. So they probably have more access than me or you. So, I'd like to talk to you about aging. I think it's a really important issue. Maybe you'll be lucky enough to talk to a staff person, but you're less likely to talk directly to a congressman or a senator. So access is important, but it can come from joining with other groups to have a good cause. I mean, elected officials want to hear from those people too. I think it's important to understand that politicians' view is to try to balance all the groups that try to influence them. So yes, it's good peace. Yes, it's the Alzheimer's Association. Yes, it's the National Council on Aging, the American Society on Aging. But it's also people who make the products and sell the medications. The doctors, the American Hospital Association. They're trying to balance these interest groups on any bill that might come across their table. And it's not an easy thing to do without being seen as favoring one group or another. I must say some people are very principled about who they listen to, but it depends on your constituency. If you're Waxman, my congressman, he doesn't have any big manufacturers here. He's very liberal. He's got a liberal constituency. That's the way his little district was defined. So he has the luxury of taking on the tobacco companies, because we don't grow any in California. The oil industry, even though there are a few oil wells here. He doesn't have any of these other groups to impact what he says he will do to any extent. So this is a simple model called the interest group model. And the legislature and executive interact with interest groups, and the legislature interacts with the executive, think of that as the president. This is very simplistic, but in this country, interest groups play a really big role. It's not true in every society. Here, definitely. Then there's elite theory. Public policy reflects the preferences and values of a governing elite. So I'll give you examples of what some governing elites might think of. Can you think of any governing elites?
Can you say that again?
Governing elites. The few who govern are not typical of the masses. Can you think of some examples of governing elites in the last 20 years?
The Kennedy family, maybe?
Kennedy family could be considered a governing elite.
The Bush families.
The Bush family.
Young Bush.
Ted Kennedy said this funny thing that someone was complaining. I don't know if you heard this. Someone was complaining that, there was at one point there was a senator who was two senators who were Kennedys, and a congressman who was a Kennedy. Kennedy was a lieutenant governor. And the Kennedys were for getting all this control as a governing elite. And Senator Kennedy said to, it was some reporter, he said, don't blame me, blame my mother. She's the one who had all these children. But there were a lot of them out there at some point. There were a lot of Bushes around, and there still were some. There were a bunch of Roosevelts at one point. Two presidents who were named Roosevelt. And the idea is these elites, they share some social values. And for the most part, it's the Bushes, if they were an elite at all, were conservative. Both Roosevelts were progressives, Theodore Roosevelt, Teddy Roosevelt, and Franklin Delano Roosevelt. The Kennedys were all liberals, different kinds of liberals, but there was some truth about that. Whether they were really governing elites is questionable. It's questionable. Because that assumes that one person or a small group of people can have power. That was once the case. Whether it's still true, I'm not quite sure. So it still says things are incremental, and it says that policy flows downward from these elites. Another argument you could make is there are very poor people, there are very few poor people who are congressmen, or senators in particular. And why is that true?
For their election.
It takes a lot of money to run in the United States to be elected. Yeah, especially now you've got to be able to do mass TV campaigns, and you've got to be able. I mean, Obama had a huge amount of money. He didn't start out. He wasn't a rich man compared to other people, but his campaign managed to get to a lot of people to contribute small amounts of money, and also to get to some wealthy people to contribute money. But his was a very unusual campaign in that respect. But it costs a lot of money. And you either have to have wealthy interest groups that will back you, or you have to have some ability to mobilize the masses. I think that's where Obama seemed to be successful, particularly among younger people. Or you've got to either get some wealth or have wealth yourself. It's very expensive to run campaigns. All right, we need to end the policy discussion right here. Bernard has important information.
So the last thing we have to do today is get signed up for doing presentations of the readings, which I prepared one, and I guess I'm not going to do it, but I'll put it online so you can see generally what they should look like. I'll start this around one here. I'll start over here, and the paper has all the readings listed, and hopefully you've looked at them and are familiar with which ones you want to do. Put your first choice on the left side, and then your second choice somewhere on the right side. The basic idea of these presentations...
Just let me say, there are no bad choices.
Just you may have interest in some areas. The book tends to focus on the same set of programs, Medicare, Social Security, etc., but the different concepts that we'll talk about over the course of the semester are all represented. For example, the presentation that I'll put up online is from this week's readings, which hopefully you notice had to do with how values influence the policy process. So the presentation should just do an outline of what the readings are trying to get across, the basic ideas, and then also try to make this into a discussion that involves the class, sort of like today was, except for you'll be leading the discussion. Each week, you'll see when the list is in front of you that each week there's prospectively 8 people working sort of together to lead these things. We have it's such a huge class that this is the way that we'll have to do it. So you can communicate with people. You can do a PowerPoint. You don't necessarily have to do a PowerPoint. If it's me, I can't remember what I'm going to say unless I have a PowerPoint in front of me, so I always use PowerPoint. If you use PowerPoint, make sure that you're succinct in your slides. If you come with 45 slides like one of these, you can take up the whole hour, and these things are only going to take up the last 45 minutes or so of class. So let's see. That's about it, I guess. Just try to. There's two parts. Try to describe what the reading says, and then try to come up with some discussion questions that will lead us into deeper discussions about the topics for the meetings.
And for the online students?
Online students, this list is going to be, I'm going to take this home right now and come up with a list of this typed out, and then I'll send it out to the online students who will fill in the rest of the spaces. The reason that we've done that is because students here have to make presentations, and students online are going to be doing it in a discussion room, so there's a little less stress. We want you to have to take those videos.
If we were doing a presentation with anybody, will you let us know that?
Yeah, I'm going to, like I said, I'm going to fill this chart out with the names and the assigned readings, and then I'll make copies of it for everybody, so you'll know who's going to be presenting that week and you can contact
So
them.
you do by yourself, like, I don't, okay, I guess I'm kind of confused, so.
You haven't seen the list. When it comes around, each reading has two names, so because there are so many people, each reading will have two people responsible for.
So I have to stand up there with someone else and do the presentation of the readings?
Yes.
But there's,
So you'll be working in conjunction with somebody else. You can divide it up. You can divide up the work. Some of the chapters are sort of long, so you can present some of the section. You can do sort of a tag team type of.
Give you somebody else to talk about the article. Like a buddy system.
So I would prefer that, because then if the discussion goes, it gives more people to sort of direct the discussion. It's not all the pressure is on you.
We'll work that out. It works.
We've had difficulty in the past when we try to match online people with in-class students. That's really difficult, but I think we'll have a much easier time if people are, if you can actually sit face-to-face and plan what you want to do.
An important announcement. Do not come next Monday. It is Labor Day. We've never heard about it. It's September 7th. That's when it occurs. And the next time, please try to come on time, because we have a guest lecturer. And I don't know that he'll talk about all the things that are listed there. But Fernando Torres-Gil is over at UCLA in the School of Public Health. And he is very experienced in Washington. He worked under the Clinton administration as, I think I told you, he was the first Assistant Secretary for Aging. And he worked in Congress, too, before that. And I think he's worked in the Obama transition period. So I'm sure he's going to come and talk about his view of how aging policy happens. And I'm hoping he'll give us some inkling about what is happening now from the inside. And he'll come for probably about 2 hours of the class. And then we'll pick up where we left off. He's going to come to the beginning.
One other thing, and that's that even though next week is Labor Day and we don't have class, you'll notice that the biggest chunk of readings is next week. And the readings cover what we didn't quite make it through today. So if you want to hear the end of the story, then you can be sure to.
So you'll say, well, how can we assign something on Labor Day? Well, Labor Day was really a creation of unions. The people who are out there working in factories and doing all the hard work. It wasn't for people who were thinking. But anyway, not to fall, so we don't fall behind, because this course is so rich in materials. We would like you to do the readings and keep up with us.
You all can pick it up front, but I probably won't be able to.